Hello, my name is Abdul Ahad, and today is the 9th of July 2025, and this is my final presentation for the course. Today I will be discussing the hemolytic anemia, a condition where red blood cells are destroyed faster than they can be produced. This presentation covers the cellular basis of the disease, its causes, genetic and diagnostic factors, treatment options, and what current research says about potential cures. So, red blood cells typically live for about 120 days, but in hemolytic anemia, their lifespan is shortened due to premature destruction. This loss leads to deficiency of healthy red blood cells, reducing the blood's oxygen carrying capacity. As a result, patients often experience symptoms like fatigue, weakness, shortness of breath, and jaundice. Next up is a cellular basis of the disease. So at the cellular level, hemolytic anemia can be caused by enzyme deficiencies like the G6PD or pyruvate kinase deficiency. These enzymes are essential for red blood cell stability and energy production, but when they're missing or defective, red blood cells become fragile and break apart under stress, such as infections or exposure to certain medications or foods. So, hemolytic anemia can either be inherited or acquired. Inherited forms include sickle cell anemia and thalassemia, which are due to gene mutations passed down from parents to children. Acquired forms result from autoimmune diseases, infections, or drugs. Both forms lead to destruction of red blood cells but differ in cause and management. So the changes at the cellular level would be like, for example, enzymes not detect, defects, or immune attack disrupt red blood cells, structures and function. The cell membranes become unstable and cells lose their ability to produce energy. This causes them to become misshapen or rigid, making them easier targets for removal by the spleen. These changes are central to the disease pathology. The impact of it goes beyond red blood cells. The spleen enlarges as it filters more damaged cells. The liver struggles to clear excess bilirubin, causing jaundice, and the heart compensates for oxygen loss, leading to strain. In severe cases, patient may develop gallstones, kidney issues, or even heart failure. So there are multiple genes that are involved in different type of inherited hemolytic anemia. Sickle cell is caused by mutations in the HBB gene, while thalassemia is involved the HbA1 and the HbA2. G6PD deficiency also results from mutation on X chromosome, and spherocytosis involves structural protein genes like ANK1 and SPTB. These conditions follow various inheritance patterns from autosomal recessive to X-linked and dominant. So the diagnosis starts with symptoms like fatigue, jaundice, and even dark urine. Blood tests including CBC, reticulocyte count, and LDH, bilirubin, and haptoglobin help confirm hemolysis. The Coombs test can identify immune-related types for inherited forms. Genetic testing is crucial and often involves a hematology or a genetic counseling referrals. So while inherited hemolytic anemia cannot be prevented, carrier screening and genetic counseling can help at-risk families. In acquired cases, prevention involves avoiding known triggers, such as specific medication or foods. For G6PD deficiency, simple avoidance of oxidative stressors like fava beans or certain antibiotics is key. Treatment depends on the type of severe type and the severity. Autoimmune forms are often treated with steroids or immunosuppressive drugs such as rituximab and sometimes splenectomy. Inherited types like thalassemia or sickle cell anemia may require blood transfusions, iron supplements, or sorry, not supplements, iron, shatelion, and even bone marrow transplant. Supportive care, including folic acid supplements, and also plays an important role in this. So the research is advancing rapidly. CRISPR gene editing offers a possible cure for genetic forms like the sickle cell anemia and the thalassemia. Targeted immune therapies, including monoclonal antibodies, are being developed for autoimmune types. These developments provide hope for long-term management or even cures in the near future. So, in summary, hemolytic anemia is a multifaceted disease rooted in red blood cell dysfunction, whether inherited or acquired. It causes serious consequences at both the cellular and systematic levels. With advances in diagnostics, treatment, and gene editing, the future holds promising options for better patient outcomes. And then these are some of the primary and secondary sources I use for this project, including peer-reviewed journal articles and professional guidelines. So yes, thank you for watching my video and have a good day.